I can't even explain. This lady would be one of the persons that I remember for the rest of my life. I can't say that.
I'm Laura Harris. I'm the Clinical Care Coordinator for the Navigator for Senior Services. Well, when I read her comments, when I read her story, it brought me to tears as well because I had no idea that I was making such a difference in someone else's life by calling her and helping her after she leaves the hospital.
I'm Lori Baker. I'm one of the social workers with TriHealth Navigator. What we do in the project for the congestive heart failure patients is Laura calls the patients within 2 to 3 days of them leaving the hospital, and then based on what's going on and what they need, she may be calling and following up with them more often. We're finding that people that have congestive heart failure often get readmitted within 2 to 3 days of leaving the hospital, and then also again between the 21st and 23rd day. So she tries to call them in both of those time frames in addition to other calls if needed. And then what she will do in talking with them is she finds that they're needing additional support and help. I will then step in and try to help with those kinds of issues.
So I called Mrs. Dodds a couple days after she had been out just to see how she was doing. And she had been trying to do what she was asked, which was follow up with finding a primary care physician and getting back for follow-up care. She had been discharged with a couple days worth of medications, thinking that once she got in to see a physician, they would give her more medications that was needed.
She went out, to me, she went out of her way to help me because when I left the hospital, she was concerned about my medicines, that they didn't give me the right medicines, and she just went out of her way. She got me an appointment to get into the clinic over there when I couldn't get in nowhere else for a long time because they weren't accepting new patients.
So she was able to get in to see a primary care physician, an OB/GYN physician. She got all her medications that she needed. She did mention she had trouble with transportation because we made this appointment so quickly. She had trouble with transportation. So I did call the social worker at the clinic and ask if the patient was able to get there, if they could help get her home with a cab voucher.
One of the things that's different about TriHealth and different about the model that we have is we have the nurse and social work model. Most hospitals and most institutions focus on a nurse-only model. And that's important to have that medical education, all of the clinical information they bring to the table. But unless we find out the reason that they're not getting to the doctor's office is because they don't have transportation, or the reason that they're not getting their medication is because they don't have the money to afford it because they're now trying to pay their electric bill too, then we're not going to be able to help solve their problem. So looking at their social problems help us to solve their medical problems too. And so that's where TriHealth is different and innovative, is the realizing the importance of addressing the social needs of the individual as well as the medical.
The thing I keep thinking over and over again is when I left bedside nursing a year ago, it was a very hard decision for me because I like to take care of people. But I've realized that I am definitely still taking care of people, especially when I hear Mrs. Dodds tell me that I have made a difference and helped her, because I may not see that, but there are people that still need my kind of help. It's just not at the bedside. It's doing different kind of nursing. And I like being able to make sure that she still gets taken care of even after she leaves the hospital.
So how are you feeling now?
Right now, this moment, a little sentimental, happy. I cry a lot though.
Perfect.
Happy moments, sad moments, whatever. This is one of my happy moments. So.